Yes, sir.
Yeah.
Thank you.
So I bring in all the wishes and greetings from Speed Medical Institute on behalf of all the faculty members
Thank you.
to Dr. Bhairavi Jha for scoring rank number 5 in AIMS through INI SS 2022 session in the specialty of MCH Plastic and Reconstructive Surgery.
Yes.
Congratulations to you. So can we know a brief history of yourself, where you started till today?
Yes, sir. I'm Dr. Bhairavi Jha. Sir, I have pursued my MS from PGI Chandigarh and I'm currently working in PGI Chandigarh only.
So you did your medicine where?
Sir, I did my MBBS from BJ Medical College, Pune.
Okay, so PG Medical College Pune to PGI Chandigarh MS General Surgery. So why you decided to do plastic? Any specific reason, or before MS or during MS or after MS?
No, sir. Actually, during MS, I initially I wanted to pursue general surgery or GI surgery only because we were always exposed to those surgeries only. But after coming to PGI, I was exposed to plastic surgery, and I found it very fascinating because it was the problem-solving branch basically, and was not limited to any organ system or any age group. So, and I also had good experience during my posting. I got to assist many surgeries, and even my relationship with my SRs was very good during that time. So that inspired me to become a plastic surgeon.
Great. So once you decided to do a plastic, then when did you start your preparation for this? And what was the time dedicated for that?
Yes, sir. I started a year back. In fact, last March or April, I started. And initially, when I gave PGI names, that they were separate exams back then. That time, I did not score well. Then I continued my preparation, and this year in Jan, because I thought my preparation was not structured. I had knowledge, but I was lacking the navigation that I required. And so time duration, actually I was working also, so time duration initially I was not able to give much. Then I resigned as a SR from general surgery, and then I started full-fledged preparation, giving around 7 to 10 hours per day as required.
Great. So what was your learning experience with Speed and how you joined Speed, and what all you learned through that? Was this content useful for your actual exams in NESS?
Yes, sir, definitely, definitely. I would dedicate a lot of my success to the speed team, sir, especially you, sir, because my general surgery part preparation, sir, general surgery is limitless, sir. So that Tuesday, Wednesday, Thursday, that 9 to 11:30 class, I used to attend religiously, and I would revise all the stuff from the Speed app only. And there's a plastic surgery lectures that too I followed religiously, making my own notes and revising them. And sir, in the last 1 week, I went through all the lectures only at 1.5 speed for my revision. So, sir, as I said, it provided structure to my preparation basically.
So were there relevance? I mean, this content were relevant to the actual exams? Were you able
Yes,
to?
sir, definitely. Yes, sir.
So, because out of our own passion, we keep doing classes because we are obsessed to do that. I mean, on daily basis, and to keep interacting with the students, and to just make some MCQs, and also to trick them and to make them see how they have understood the subject and all that. So it has become more of a passion driving us to do that, and it should make a relevance at the end of the day.
Yes, sir. I can never forget the things you used to say, that you have to understand the mindset of the examiner. So that is something I try to incorporate during my preparation. That I have to think like the examiner, what they want as an answer. That helped me in exams, sir, definitely.
Great. So who recommended you actually? I mean, for this speed actually? I mean, you join. How did you join this?
Sir, no particular recommendation as such, but one of my juniors had attended Speed 1 year back.
Okay.
So she had said that the plastic surgery content was quite good. And sir, I have never been taught plastic surgery as such, so I needed some guidance in that.
Because in MS general surgery, there is no exposure for plastic, or even for cardiac or for neuro. It's predominantly all gastro. So
Theoretical part I was never exposed to. Clinical part a
Yeah.
little bit I was exposed during MSc.
So how many questions did you attend in this exam out of 80?
Sir, I attended 70 questions, sir.
So what will be your advice and take-home message for the juniors or your colleagues and who want to pursue plastic surgery as a career in the future?
Sir, I would definitely advise them to purchase the Speed app, because I had advised, in fact, some of my urology colleagues, I had recommended them. They had taken also in ESS.
Doctor, I want to ask you a question. Where you are going to planning to do a plastic surgery out of this rank?
Sir, my preference was PGI Chandigarh, but probably I won't be getting that. So let's see where.
So your preference is PGI Chandigarh?
Yes, sir. But common merit list rank will not permit me to get PGI Chandigarh as such, I think.
How many seats are there?
Sir, 4 seats are there.
One rank. That's only one. You are by one. If any of that person is taking in AIMS or in any
No,
other
sir. My AIMS rank is 5th, sir. Common merit list rank is 9th, sir.
Okay. So your chances of getting it will be where?
Sir, probably AIMS Delhi or AIMS Rishikesh. Depends on what the others take. Because there are 4 seats there. 2 in AIMS Delhi and 2 in AIMS Rishikesh.
So your preference will be PGI Chandigarh, and I pray that you get it in this counseling.
I hope so, sir, and thank you so much.
Well, now one unique thing which I am looking at in this interview, I mean, I have made an interview almost 4 to 5 people today out of PGI Chandigarh, especially surgeons, and they want to do their MCH in PGI Chandigarh only. I mean, they don't want to move out, and they want to be back in their own place, in spite of getting AIMS also. I mean, just now I spoke to Kapil, and he scored rank number 1 in urology, probably you might have known him. He's from PGI only, na? So you want to do urology only in PGI, and in spite of rank, I mean, a seat available in AIMS also. I think there's a strong, an emotional bond and a hold for the parent institutes.
Yes, sir.
It's good. Great.
Yes,
so
sir.
once again, I wish you all the best and all the success as a great plastic surgeon in making, and you'll do wonders. And so it is more. It's a skill. That's what you said. Surgeon, the most skillful, we always say, is on, if you look at on a cosmetic basis, it is on plastic. And also not only cosmetic, aesthetic, cosmetic, in whatever way that because that is the outlook that anybody has, and also the structural build that anybody has, and the finer aspects. We say when one finer aspect is not happening, it will disfigure the architecture. One final aspect does not happen for a cardiothoracic surgeon, the patient will be will die. Okay, one not proper, not an iota, chapter closed. So, that's how it is, and I wish you all the best and all the success in the years to come as a great plastic surgeon. Thanks for your time. Thanks for being with us. Thank you very much.
Thank you, sir.
Bye-bye.
Thank you, sir.
Thank you.